let's talk about therapy. Hey everyone, my name is Lindsay. Welcome to my channel, or welcome back to my channel. Here on YouTube, I upload very girly girl, chronic illness, disability awareness and advocacy, lifestyle, fashion content. For today's video, I'm actually going to be talking about mental health and more specifically, my advice for starting therapy. Recently, literally the week that I'm filming in this video, just now got back into therapy. I've been trying to get back into therapy since March as someone that lives and deals with depression and anxiety and medical trauma. I am a really big believer in therapy, and I think anyone and everyone could benefit from therapy. It's just a judgment-free place where you can say literally anything and everything to someone who's not biased and can maybe help you work through some of those feelings, emotions, experiences, whatever it may be. But I had some requests asking for advice on starting therapy because it can be intimidating going into therapy, not only as a first-time therapy goer, but even as a repeat person who goes to therapy. Talking about it coming from someone who has personally been in and out of therapy for a majority of my life, I know that it can be nerve-wracking. I just wanted to give you all some tips, tricks, advice in terms of ways that you can prepare or things that you can look into so that you can feel your best in terms of starting therapy and feeling like you have a basic knowledge of what you can do to feel like you're prepared for it and to feel ready to get to that step of starting therapy. Because let me tell you, it can make a huge difference. I've seen firsthand how helpful it can be and how much of a difference that it can really make in a mental health journey. I have a checklist on my computer of things that I've written down so that hopefully I stay as organized as possible. So let's just get right into this video and let's talk about therapy. First things first, knowing that starting and showing up with the nerves, with getting started, there's so many unknowns that it can be very, very intimidating. It does get easier once you start the process and when you show up to that first appointment. It doesn't always go perfectly, but that's gonna be one of the hardest parts of diving into this world and getting therapy. It's totally normal to be anxious and nervous about talking about your life to a stranger. That does, I think, go away with time, especially when you find someone that you really click with. It definitely does get easier and less intimidating over time. As someone with anxiety, I can say that, but it can sometimes take time to get to that point. It's definitely normal to be a little bit anxious, and if you're not, that's even better. Even me starting up, it's been about 6 months since I've been in therapy, and I was so nervous because it was a new person, so totally normal. Something that really helped me was doing research on the different types of therapy. So there are several different kinds of therapy. To give you some examples, there's CBT, which is cognitive behavioral therapy. There is EMDR, which is eye movement desensitization something. It's with this light that goes back and forth that you kind of follow with your eyes. Wow, that makes me dizzy. I'm not going to do that. But there's other different types of therapy as well. So doing some research to see what type of therapy you would best benefit from or what might work best for you. When your backyard catches on fire, you can see the ash. Ooh, it's getting worse over here. It's getting worse. That is a good flame too.
Well, there's so much underbrush to...
Yeah, to catch. It's starting to catch over here again too.
And that's what it'll do, because it hides underneath all the leaves.
Yeah.
And...
Lovely. Just another day. Yeah, you can see the smoke. Damn, they got a whole little flame there now. Should I bring some marshmallows?
While we're at it, the house might catch on fire,
but you know, I'll bring some. I got some marshmallows and some graham crackers. Oh my gosh.
That's close.
Yeah. I'm back. Our backyard caught on fire. I'm minding my own business, sitting here trying to film for you all for the first time in a month or so, and like the easement part of our backyard just caught on fire. So we called 911 and was a whole long part that was like just slightly on fire. They got out part of it, and then there's this one part that's like actively cooking and getting bigger. There was literally ash just spilling down, and they have a few firefighters there right now. Stress, anxiety. Owie, that made my head hurt. The smoke made my head hurt because it was pretty smoky. Just another beautiful day. I'm gonna get my life together. I know, Simon, it's okay. Simon's alerting because I was running up there to see if I could do anything. But fingers crossed. Thank you, first responders, for what you do. Because right now you're literally saving our house because we are in a red zone. Sorry for the interruption. Let's talk about therapy, right? Okay, it's good to get referrals, get names from different doctors. You could ask your primary care or another doctor, hey, I'm struggling with my mental health. I'm thinking about therapy. Could you send me some names? Asking for a referral from other doctors could be helpful. At least they know you and they can recommend someone they think might be good for you. So that's something else that you can do in terms of where to start. Finding names, finding therapists, asking one of your other doctors could be a helpful place to start. Also, I think it's called Psych Today is where I looked a lot of times for my therapist. Psychology Today. Psychologytoday.com. This is not sponsored. I've literally used this website for looking for a therapist for a long time, since I was in college, high school, etc. It's a great place to start. Making sure that you're researching and vetting the therapist that you are thinking of going to. I wish that I would have done this. Trying to find reviews in terms of other people's experiences. There's one doctor that I wish I would have researched. I didn't. I wish I did. Looking up the person, looking up reviews. A lot of them will have bios or specialties or insurance that they take. Researching and vetting the therapist that you were thinking about can sometimes save some heartache if it's not a match for you. Something to keep an eye also is costs. Some therapists won't see someone out of network if they don't take your insurance, which this is also something that's so difficult. It's really hard because a lot of therapists are out of pocket and they don't take insurance or Medicaid, Medicare, and so that can make access to a therapist even harder, and it's not always accessible. It can be difficult, but patience is a virtue in this situation. It might not be a super easy process to get in, which is really unfortunate, but trust me, it's worth it, okay? You got this. Also making sure that the person you are trying to see works in what you are wanting help with. So I always try to look for a therapist that specializes in depression and anxiety, possibly medical trauma, chronic pain. I always try to make sure that I find someone who specializes in what I'm looking someone who specializes in what I need help with. I don't know why that was so hard to come out. I feel like that smoke messed with my brain a little bit. I don't know if that can be a pseudo trigger, but I feel a little foggy. Deciding if you want to do therapy virtual or in person. So everyone is different with this. I have friends who can only do in-person therapy because they won't necessarily get the help that they need virtually. It's definitely a different experience meeting with someone virtually versus meeting with someone in person. Personally, I am a virtual therapy girly because I can't drive. In person is also an option as well, but it is going to be important to know what you're looking for because some therapists only do in person, some do both, and vice versa. Figure out what works for you is going to be the most important part of all of this. I'm literally so anxious because my mom keeps going in and out of the house. I don't know if I'm seisurey or anxious, and I think I'm a little bit of both right now, but I am dedicated. I want this video for all of you. Something else that will be important, knowing what your availability is and looks like. So a lot of therapists only have certain days that they see patients on, or only see patients from this time to this time on this day. So knowing when you have availability for therapy is also going to be really important in terms of finding someone that can work with you on that schedule at the times that you are available. Next thing is one of the hardest, but the more honest you are, the more help you're gonna get. Being honest and vulnerable is really, really hard, especially living with mental illness. Being honest and vulnerable is really hard for a lot of us, and it can be really scary and intimidating. But the more honest and vulnerable you are, the more that your therapist can help you, and the more that you may benefit and learn about yourself, because your therapist can't help you unless you talk about what you're struggling with and you're honest about what you're doing, what you're not doing. Especially being honest about what you need, what you're looking for in a therapist, what you want to gain, what you want to work on, knowing what you need, as well as being descriptive about what you're dealing with and what you're going through and what you're struggling with is going to be two important things when you're going to therapy. Knowing what you need is going to help to give your therapist a good direction in terms of where you want to go with therapy. Explaining what you're dealing with and going through is going to give them a place to start and a place where they can figure you out and how they can help. So those are two very important things to know going into therapy. Be ready to talk about yourself, which I know can be very weird for some people and uncomfortable, but that's what therapy is there for. It's there for you to have an open window where you can say literally anything and everything on your mind and for them to help you work through it. Be ready to talk about yourself, your experiences, the things that are bothering you, and what you need help with, because that's the only way that they're actually going to know what's going on so that they can help you, give you things to think about, work on, better ways to cope. It might be uncomfy, but you're going to have to talk about yourself. It's the only way that they can help you. A lot of people will want you to start with talk therapy before moving into medication world. I've been in therapy since high school, but I didn't start antidepressants and anxiety medication until college. When you are starting off your therapy journey, if you don't have like a diagnosis yet or you have an idea what's going on, sometimes writing down symptoms or concerns, what you're experiencing, questions that you want to ask can be really, really helpful. Especially me with chronic illness, I get a lot of brain fog, and when I'm really anxious, I know a lot of times I just kind of blank. Personally for me, I write down everything. Help me remember what I want to talk about and what I want to bring up. Totally normal, and even if you do forget, it's not going to be the end of the world. That's the therapist's job, is to pull things out of you sometimes. Like, you're not always going to know what you want to talk about, and that's also completely okay. Especially when you're first beginning, writing down symptoms, thoughts, like different things you're having can also give them a little bit more information about you and how they can help you specifically. Setting goals is also going to be a really big part of therapy, and if this is intimidating at all, it's okay. It's perfectly normal. You're definitely going to want to start small and then grow bigger, and if you don't know where to start, it's okay to ask your therapist. That's what they're there for. I'd be like, I don't know what to talk about. That's part of their job, is to help you work through what goals you want to set, where you want to start, how big or small of a goal that you want to do. That's part of their job too, is to help you go through that. But setting goals is important so that you can celebrate no matter how big or little the win may seem, to be proud of yourself and how far you've come, because even starting therapy in its own is a big deal, and that's a lot to be proud of because it's not an easy thing to do. Ask questions. Ask lots of questions, whether it's how this therapist works, whether it's what kind of therapy they specialize in, whether it's what they typically do in therapy sessions or how they work. Feel free to ask questions. That's part of the experience. If you want to ask how to deal with something, if you want to ask what you should do in this scenario, that's what they're there for. It's okay to ask questions depending on your experience, because everyone's is so different. This is super duper duper important. If you're gonna take anything from this video, take this. You are not always going to match with the first therapist you see or meet. This is something that I really struggled with. It's really weird because people say to date your therapist, and it kind of is really true. It's so important to know not every therapist is going to be a match. Not everyone is going to click, and that's okay. That is actually very, very normal with like almost everyone who goes to therapy. So it's important to be patient, and it's okay to be like, hey, I don't really click with you. I'm going to seek help and assistance elsewhere. That goes along with my next tip. If it's not a match with someone, it is more than okay, if not encouraged, to switch therapists. If you know you're not going to make progress with someone, or you know that you don't click and you're not going to be comfortable talking with someone about the inner depths of your soul and what you're struggling with and going through in your brain on a day-to-day basis, it's okay to switch to someone who makes you feel comfortable, who brings you that safe space that's judgment-free, where you feel comfortable and confident talking about the things that you're going through, and who you feel confident will give you feedback that will actually benefit you. Doesn't mean there's anything wrong with you, doesn't mean there's anything necessarily wrong with the person. I mean, I'm not gonna blame you. I have seen therapists who have completely blown me off and gaslit me, and it was like not great, but I've also had therapists who have kept me alive and who have changed my entire life and perspective on how I view certain things. The work is worth it, coming from someone who has had so many therapists. Some that have worked, some that have not. It's completely about finding someone who works for you. Remember that therapy is confidential. You can literally say whatever you want to your therapist. It's not like when you talk to family and you're worried about how they feel, or you don't want someone to be worried about you. Your sessions are confidential. Your mental health, mental illness, things you say is confidential between you and your therapist. The only times in which a therapist could release private personal information, you sign a form specifically stating what can be told to what person, or if you are an active danger and threat to your safety or someone else's. Other than that, it's confidential. It is you and your therapist. You say whatever you want. And also keep in mind, not all of these ideas or tips are going to be helpful for everyone. Everyone is different, especially when it comes to mental health, because there's so many different kinds of mental illness and not everything is going to work for everyone. I just hope this video can give you a bunch of ideas in terms of things to think about. If you're starting therapy, different things are not going to work for everyone, but I hope this can at least give you some general ideas and you can kind of maneuver them into what would best work for you, because that's what all of this is about, is whatever will best help you is what's most important. Next thing is to set boundaries. And yes, you can set boundaries with your therapist. The two biggest things I think that's gonna come in terms of this, usually therapists will have one of two ways of functioning. You're gonna have a therapist that's like, call me anytime, day or night, I'll answer, I'll go back to you. Or you have a therapist that's gonna be like, I'm available to you during sessions or during business hours, but when it comes to personal time, I am not accessible to you. This goes into figuring out what you want or who clicks in a therapist. If you want one way or another, that's something important to figure out in the beginning, but it's okay for you to set boundaries. It's okay for you to say, hey, I don't think we're going in the right direction with this. Can we reroute what we're talking about? Or hey, I don't want to talk about this. I'm not comfortable talking about this. Can we talk about something else? The whole idea of therapy is for you to work things out in whatever way works best for you. So be confident in that. Figure out how they can help you best, but you are in the driver's seat. If you're not comfortable with something, speak up, let them know. It's okay for you to set boundaries. This can be different for everyone, but if you need some kind of emotional support, it can be helpful to have someone bring you or to have someone accessible before, during, or after. A lot of people don't usually want anyone with them during, because like that's the whole confidentiality part of it. But if that would help you, go for it. I usually like having someone with me or available after a therapy session, because I feel like I never know. I feel like it's either going to be like a chill therapy session or it's going to be like, I made traumatic connections and I just bared my soul to this person and I'm mentally like processing everything that we just talked about. Having some kind of loved one or friend there for emotional support can sometimes be really, really helpful. And you don't even necessarily have to tell them what you talked about. Just have someone there to support you, whatever would help you the most. Be gentle with yourself. Be kind to yourself. Therapy is a lot. It can be very draining, especially when you're diving into trauma or things that have like forever impacted your life. Like it's not easy to think about the hard things, to talk about those things, to go into detail, to make hard connections, to be called out on behavior that's not helpful or that's not safe. It's really hard to be open and to talk about those things. It's work. It can be really difficult, but I've personally seen firsthand how much of a difference it can make and how helpful it can really be if you give yourself to the process and you let yourself be open and vulnerable and put in the work. It can change your life. If you need to use this video as a sign that it's okay and it's gonna be hard, but it's gonna be helpful, it's gonna change your life, you can get through this and you are not alone, and there's people who love you and are gonna help you get through this, and hopefully therapists can be one of those people in your team to help you have that support and love. Just know that it can make a really big difference. If you feel content and you feel like you truly like don't need it or you're in a safe place, then that's totally cool too. Like I said, as someone who's been in therapy since high school, I've had periods where I'm consistently in therapy for years, and I've had times like this year where I haven't been in therapy since March, but I know that I really need it, and now I'm back in therapy. It's a journey that is ongoing with chronic illness, mental illness. It's something that you're probably going to be juggling the rest of your life, but I know that, especially me personally, therapy has completely changed my life for the better and kept me alive and helped me learn so much about myself and life and experiences that I've gone through, make sense of things. It can be really, really life-changing, and I hope that you give it a chance if it's something that you're really thinking about. My camera overheated. We are almost done this video. I promise I'm wrapping it up. Make sure that you work together with your therapist to build a safety plan. Basically, an emergency plan plan. The whole goal of it is to keep you safe. As someone who has personally battled depression and SI, an attempt, and a few inpatient hospitalizations, the most important thing is your safety. And it's not easy, it's not something that's fun to talk about, but your safety and your well-being and everything is the most important part. If that's something that you struggle with, is definitely going to be really important as well. But yeah, building a safety plan so that it's there when you need it. And your therapist can help you make that too. This is also something that is very, very important that I also really struggled with. Know that there is going to be ups and downs in your therapy journey. There's gonna be mistakes, there's gonna be relapses, there's going to be setbacks, but the most important thing is what you do after that. Picking yourself back up and deciding what you do next. Trying again is gonna be the most important part. If you fall off the horse, get back up and ride it again, because it's not always gonna be easy. It's not always gonna be, I'm healing, I'm healing, I'm healing, woo! It's gonna be, I'm healing, relapse. It's gonna be, I'm healing, I'm healing, I'm doing good. I had a setback. Life is a road under construction. Same goes for therapy. There's gonna be setbacks, there's gonna be relapses, there's gonna be harder times where you really just feel like you wanna yell at your therapist, and there's gonna be times where you're laughing with your therapist. There's no such thing as perfect therapy experience. There's gonna be ups and downs in it, and that is okay. That is normal to experience. Getting back up and trying again is what's most important, and not giving up on yourself. You are capable of so much more than you may think you are, and I'm sorry that you have to be this strong to even have to go to therapy. Work is worth it, and your safety and happiness and well-being is the most important thing. And I have to take my own advice. Don't expect perfection from yourself. There's no such thing as perfect. You don't want to set up unrealistic expectations for yourself. Don't expect perfection from yourself, because that's unrealistic, and you want to set yourself up for success. So work with your therapist to figure out what that looks like for you. As I mentioned throughout this, patience is going to be important. It used to be a little easier, but it can be really difficult to get into therapy these days, so it is going to take patience. And my last two things and tips and advice for starting therapy is be proud of yourself for even trying. If you're watching this video, you are thinking about therapy, you are in therapy, you are a loyal follower, friend, family, but it's so important to give yourself credit. If you're even thinking about going into therapy, that's a lot. That's a big deal. That is something to pat yourself on the back with and to be proud of yourself. Life is hard, especially these days. It's like the entire world is stacked against us, and we're just having to do our best to survive. It's okay to be proud of yourself, even for just watching this video, even for just considering starting therapy, because it's not something that's easy to do. Trying to meet with a therapist, showing up to your first session, that is something to celebrate. And as hard as it is, and as scary and uncomfortable and intimidating, that's a big deal, and you should be very, very proud of yourself for even getting to that point of you thinking about it and trying and showing up. Be proud of yourself. I'm proud of you. Know that you aren't alone in your battles. That's one of the number one things my chronic illnesses and depression and everything tries to do, is isolate myself. But knowing that I'm not alone and knowing that you're not alone is something that can always bring me a little bit of light and hope. You can do this. I love you. You are an amazing person. The world is a better place with you in it. You should be proud of yourself, even for watching this video and thinking and trying to start getting into therapy. That's a really big deal, and I'm really proud of you. You are not alone, and you got this. All right, everybody, that is it for today's video. It has been quite eventful, from the brush fire in my backyard to my camera overheating to the intensity of the topic that we were talking about today. I really hope that this video was helpful. I hope that this was able to give you some more confidence in terms of starting therapy. Like I said, I know it can be intimidating, but you are not alone, and I believe in you, and you can do this, and it's so worth the work. As someone who's been in therapy for so many years, I wanted to share my experience, so hopefully you all feel less alone and can get some, you know, big sister advice in terms of what to expect and what should I do and how do I prepare and what do I expect. I hope that I was able to ease your mind a little bit, give you some things to think about in terms of preparation. I really, really hope this video was helpful. If you have any other tips, tricks, advice, things to think about, feel free to comment down below. This community is intended as a place where we can be honest and vulnerable and support each other's ups and downs and health journeys and battles with chronic illness, mental illness, whatever that may look like for all of us. I love you so much. Don't forget to give this video a thumbs up if you liked it and it was helpful. Comment down below any tips, tricks, advice, extra support or love or experiences that you have that you want to share talking about therapy. Don't forget to stop what you're doing and subscribe to join the family, and don't forget to turn on that notification bell so that you know whenever I upload. I love you all so incredibly much. I am sending you all my love and spoons. I will see you in the next video. Bye everyone. Mwah!